In April 2014 to June 2016, thousands of Flint residents were exposed to dangerous levels of lead. Legionnaire disease killed at least 12 people and made dozens more ill. This happened because managers who reported to the Michigan State Treasury Department decided to switch the city's water supply under the supervision and guidance of Governor Snyder. The spike in Legionnaire disease in Flint is what led health officials to start questioning the water quality. Attempts to investigate were met with resistance at the city and state level. In 2015, dangerous levels of lead were detected at 2 drinking fountains at the University of Michigan Flint campus. In April 2015, EPA Regional Manager Miguel Del Toral expressed his concerns, but Michigan's Department of Environmental Quality insisted that no steps were needed to mitigate the levels of lead in Flint's water. In September 2015, a Virginia Tech professor named Marc Edwards determined that the insufficiently treated water from the Flint River was contaminated with lead from old pipes. Results were confirmed in October 2015. Genesee County was forced to declare a public health emergency in Flint. The county urged residents not to drink water from the Flint River. The following day, a press release from Governor Snyder's office claimed that Flint's water was safe. A week later, Snyder had announced a $12 million plan to switch back to the DWSD water supply. In March 2016, the final report placed blame on the state, more specifically on the MDEQ, for insufficient water regulation. Former Governor Rick Snyder and his administration eventually faced charges of willful neglect of duty for their role in the water crisis. More than a dozen state and city officials were indicted for their role in the water crisis. Many of them accepted plea deals in order to avoid time in prison. A thorough review of the emergency manager system showed that the crisis was a clear-cut example of environmental injustice. Flint's low-income, majority African-American population did not have the same level of protection from environmental hazards as did their neighboring communities. The CDC found that almost 100,000 residents had been exposed to lead from April 2014 to October 2015. Scientists also linked the Legionnaire's outbreak conclusively to the water supply. The EPA gave the state of Michigan $100 million to fix Flint's drinking water infrastructure. The grant was provided by the Water Infrastructure Improvements for the Nation Act of 2016, which will enable Flint to accelerate its work to replace lead plumbing and make other improvements. The Flint River was a corrosive and unstable water source. It did not have corrosion control or orthophosphate corrosion inhibitors. To address the disinfection, the water operators switched the sulfate-based coagulants to chloride-based coagulants. This increased the chloride to sulfite mass ratio from 0.45 to 2.04, which is above the critical range of 0.5 that can predict the accelerated lead corrosion. Laboratory experiments have confirmed that this increase in corrosiveness due to lack of corrosion control, plus the increased CSMR level, could be a predictor for significantly increased lead corrosion in the water supply. Since 2016, the EPA has been sampling Flint water to ensure that actions were taken and that the water quality continues to improve. Data from the EPA, MDEQ, and other sources show that there has been progress and lead levels have decreased. Virginia Polytech Institute did a follow-up study to evaluate the long-term effectiveness of the lead interventions. Data was compared from August 2015, July 2016, and August 2017. 145 Flint residents participated in the sampling campaign, and the lead levels were found to have decreased in this study as well. The CDC provided assistance and funded recovery efforts. Some of these efforts included health messaging, assessing lead exposure, providing guidance on protocols, and linking community members to appropriate services. In response to the public health crisis, Congress created the CDC-run Federal Advisory Committee. Congress also funded a CDC-run childhood lead poisoning prevention program and a voluntary Flint lead exposure registry. The registry is designed to monitor health, child development, and ongoing lead exposure in Flint. It is also being used to improve service delivered to lead-exposed patients and to coordinate care with the community and federally funded programs. The CDC is using this data to try to prevent future crises like this one.